Good evening and welcome to all my replay viewers. Welcome. Thank you for checking in. You can still swipe and share if you find this content valuable, and you can also give hearts if you like what you're hearing. My name is Chris Neesmith, the Change Agent. I appreciate you guys checking in with me today. Quick 5-minute scope. This is going to be very brief. Just a quick 5-minute scope talking about very important subject, which is open enrollment. I'm going to be talking to two people here. I'm talking to the employers and I'm going to be talking to the employees. So if you're taking notes, grab a quick pen. This is going to be very short and sweet. For those who don't know me, my name is Chris Neesmith, the Change Agent. I work with business owners who want to reduce their overall operating expenses every month. I show them how to increase their profit margins by 20 to 30% within 60 days and grow their business using technology like social media, text marketing to get more customers, but also work with individuals as well. So that's why I'm talking to the employers and the employees today, because right now is open enrollment, which is a very important time. So grab a quick pen. This is going to be a very short 5-minute scope, but I want to talk to you about, this is going to be a product scope. I'm going to talk to you about a product that I strongly believe that a lot of people can benefit from, that I use personally myself, and I refer it to my clients as well. So we're going to talk about a service, a healthcare service that anyone can utilize. If you can see that, healthcare coverage for your entire household for just $49.95 a month. Let me keep that up for a second. Healthcare coverage for your entire household for just $49.95 a month. Now we're talking saving time and money, 24 access to doctors and nurses, no social security number needed. Let me repeat that. No social security number needed. Let me repeat that. No social security number needed, and access to prescriptions right over the phone. Folks, so let me talk to the employer. If you own right now, the marketplace is crazy right now because the fines are hefty and large this year. So if you have less than 100 employees, you no longer have to offer health insurance to them. But what you want to do is make sure you offer some type of service to keep the loyal employee base at your establishment. So here's what you can do. If you decide not to offer healthcare insurance to your employees any longer, you can actually offer this service, which would be $49.95 a month for all your employees, which what I encourage a lot of my clients to cover on behalf of their employees. So this way they can get discounts to dental, vision, chiropractic, alternative medicine. They get telemedicine, which is access 24 hours a day, 7 days a week. They can talk to a nurse, they can talk to a doctor who speaks over 100 plus different languages right over the phone, can diagnose them right over the phone, write prescriptions, and actually schedule blood work right over the phone, which is huge. Now, by having access to the service, that employee can then get access to our shopping portal where they can actually shop for full-fledged health insurance. The Aetna, the Blue Cross Blue Shield, all the other companies. We got over 600 agents on standby that can help them get full-fledged health insurance, which includes subsidies and other benefits. So by you not offering service, they can actually get this service, still get full-fledged health insurance, and get better coverage than what you're currently offering them as the employer, which is huge. Your employees are going to love it. They get a better coverage. They can choose a bronze plan versus one of the silver plans with the Affordable Care Act and still have access to doctors, nurses, vision, dental, chiropractic with this plan. Now, the employee or the entrepreneur, the business owner. A lot of entrepreneurs, if you're in direct sales, if you own a brick and mortar establishment, the last thing a lot of entrepreneurs look at is having healthcare coverage for themselves because they're so focused on building a business, and if they have any employees, they're focused on them, and the last person they tend to look at for health concerns is themselves. Well, this is a service you can actually get as well for $49.95 a month, which is a tax write-off as well. You can get access and get that full coverage yourself, and that covers your entire household. Now, here's why I'm talking about a household. If you're married and your spouse, let's say your mother-in-law, your father-in-law is in town for that weekend and they're staying with you, they're included in that household. That's amazing, folks. That is huge coverage that anyone can use. 9 times out of 10, versus going to the doctor, you can be diagnosed right over the phone. If you got strep throat, if you got a sinus infection, you can talk to a doctor or nurse over the phone. They can prescribe something for you right over the phone. You go to a local Walmart, you pick up your prescription, you come back home, get into bed. No urgent care, no co-pays, none of that. This is where we're talking about huge savings. So when you look at your service, if you're an employee and your employer is offering a plan and the deductible is $4,000 or $6,000 or $10,000, and you'll never make that deductible to get full coverage, this is a service that's going to help you. So the strategy is in place, which is going to help every household across the country. So I want to do this quick scope that I wanted to make sure that everyone knows this is open enrollment. The window is very, very short to capitalize on open enrollment, but this is a product that you can purchase anytime. Now, let me repeat that. This service saves time and money. You got 24-hour access, 7 days a week to a doctor or a nurse over the phone. No social security number needed. So for documented workers or undocumented workers, as you're getting your papers together, you can have this service for your entire family. And you get access to prescriptions right over the phone. We got a nationwide partnership with Walmart. So if you want to get more information on this product, just to research it yourself, tell you a quick story. I used the service a few weeks ago to go see a chiropractor. I was checking the marketplace here locally in my city, and I've seen initial visits from $150 to $160, and then the visits afterwards would be in the upwards of $80 to $90. Well, I went and seen a chiropractor for $40 my initial visit, and any subsequent visits are only $25. Folks, this plan works. This is how you can get more information. If you go to www.shopformedcoverage.com, again, that's www.shopformedcoverage.com. And for those who are following me on Facebook and Twitter and also on Periscope, you can always just shoot me a quick message. That's Change Agent 5 at Twitter or on Periscope if you follow me, or you can always go to www.rocsavings.com and go to the Enhanced Care MD bundle package, and you can see more information. For those that are just checking in, the late visitors, this is Chris Neesmith, the Change Agent, just doing a quick scope. It's open enrollment. Healthcare is the talk of the country right now. You want to make sure you're covered, your family's covered, and this is a great plan that I recommend to a lot of my clients. I use it. It's only $49.95 a month. Healthcare coverage for the entire household. That is huge. So you can always get more information. You can go to this website, www.shopformedcoverage.com. I appreciate you following me. If you like what you hear, you can always give hearts. Definitely swipe and share this information. If you know someone who recently had a new birth, who has a large family, an entrepreneur, anyone can use this service. So I definitely recommend swiping and sharing it with your followers, with people on Facebook, on Periscope, because you can make all the money in the world like we talk about being an entrepreneur, but if you don't have your health, what good is it? Because you're spending all that money that you generate to try to regain your health, especially in the later years. So this is Chris Neesmith, the Change Agent, doing a quick scope. I appreciate you checking in. Talk to you soon.